And I just want to again, on behalf of the Gulf Coast Medical Society, thank all of you for your incredible words of wisdom, your commitment, and all the rest of the audience for coming out on this cold, almost wintry day in Sarasota. It's a big deal for us down here. We would also like to thank our sponsors, number one in particular, Ms. McKenzie. The hospital has been wonderful. We really appreciate the use of the space, their support in helping with the organization. We're really a small organization and we need all the help we can get. The Medical Education Committee helped us to make sure we could have continuing medical education credits. And we want to thank the Sarasota County Department of Health, loaning us Dr. Abu to do all this extra work in between delivering babies and sending emails at 2 o'clock in the morning. The Manatee County Department of Health, the Sarasota Memorial Healthcare Foundation, the Florida State Medical Association, my organization, the Multicultural Health Institute, has greatly enjoyed being a partner with this, and obviously the National Medical Association, and we really want to thank Dr. Edwards again. And as I told her last night, feedback we got from the grand rounds yesterday, several of the doctors remarked that it was the best grand rounds that they had ever heard. So I think we should give you another round of applause for that. In summary, I really enjoyed being in the audience and listening to such resonance with the kind of things that I try to teach about. And it makes it really easy to summarize when there is such a confluence of thought. You know, I think that it's really interesting when you see this type of synergy and you hear these experts who really are modeling what we all are trying to be, which is to be the good that we want to see in the world, be the change that we want to see in the world, which I think we all hear that statement. And I think more importantly is the whole concept that and I love Wayne Dwyer, and he says that if you visualize it, you can realize it. And that despite our differences, whether perceived or real, that if we can work collectively and in this human family that we're a part of, that we can use the available information and create a common vision. Because that's really what it's all about. How are we going to get there? Everybody wants to be healthy themselves. But how are we going to be healthy as a community, which will actually improve our own health? You know, for those employers who don't want to invest in the health of their employees, it's very short-sighted because Ms. McKenzie already mentioned that if you invest even a little bit in helping to incentivize people to be well, you will save money. You will improve productivity. So it comes down to this kind of moral and philosophical standpoint. I think when we look at the information that we have at hand that was brought up repeatedly, the importance of the social determinants of health, and that if we could really look to stop spending such a large amount of money on a small percentage, 5% of the people taking the majority of the cost of health care, what are some of the other more creative ways that we can look at that? For example, I'm a physiatrist. I deal with catastrophic injury. I deal with people who are really walking miracles, people who've been in coma, people who've had amputations, etc. If we had a way to focus care and carefully coordinate care for that population, millions of dollars would be saved. I think the idea of using the assessment process, particularly with community-based participatory research, which is an emerging field, where we really partner with communities to avoid this kind of top-down, where we know this is the problem, so this is the solution. You know, from people that are sitting around talking in theory as opposed to taking in the input and the information from the communities. I'm happy to report to you that I came to this group several years ago and we talked about the beginning of a community assessment that we were going to do. We are now in our 4th year of this process where we've developed a cadre of community health workers. We conducted a community survey, we had a town hall, we got feedback from the community. We have begun to train these workers in the areas of highest need to address the disparities, including cardiovascular health, HIV/AIDS, diabetes, and now cancer. And we're going to continue this effort with very, very limited funding, but what's so excited is the passion of the community because they now feel that they're a part of this process. And when you talk about farmers markets, one of the things we did in formulating the Community Health Action Team, which now is being coordinated by members of the community with ongoing facilitation, one of the ideas they came up with was they wanted to have a walk and to have a group of people so it would be safer because they knew they would all be walking together, and then the people that participate in the walk would get a $5 coupon to use at the farmers market that we got going in the area where there's the highest concentration of African Americans here in Sarasota. It's a very simple concept, but it worked very nicely. How do we replicate those things on a grander scale? But that came from the community, and these are the kind of things where maybe we're not always having all the answers, even though we may be considered the experts. I think the ultimate goal of looking for equity and social justice that has been echoed, I mean, we cannot lose sight of that. What kind of country would we be if we said that we're the leaders in the world, economically and in all these other areas, but if we don't hold up social equity and really believe, as I remember in my student days, that health care is a right, not a privilege, then what do we really stand for? Just making money to all other end, and then we can't even enjoy it because we're not healthy? I mean, that doesn't really make a lot of sense. And I think the idea of bringing up the next steps, that we have to work on breaking down this segregation, whether it's actual physical or whether it's actual mindset, and that we increase prevention. I totally agree that we should increase the budget, not only double it from 3% to 6%, I think we should triple it to 9%. When we look at the possible positive impact of the screening that can be done, and Dr. Shahawi had people come and speak at our town hall, and we got several people that came and did the screening, and it's been very beneficial, and it's a way to help reduce costs overall. I think resurrecting the health nurses. If I had a couple of good public health nurses to work with my community health workers, it would be amazing the impact that they could have, and they were already an integral part, an accepted part of the communities. These are the kind of creative ideas that we have to think about. And I think overall that if we just continue to improve the quality and coordination of care and the type of policy that we're trying to put in effect, that we can improve the health of this country, and that we can be as we should be as a family. We really are a family. We really are together. We don't always get along like a family, but we really do want to see everyone be well, and in that way we all can be successful and share success. So I want to thank you all again for coming today. I'm going to keep my comments very brief, but I think some of us will be here for a little while to continue to answer questions. And one last thing, I just would like my students who came, there are some students here, and they're the hope of the future, and I want them to stand up, and for everyone to acknowledge them for coming out on a Saturday morning. Yeah? Okay. And we welcome more mentors and anyone else interested to work with us in our efforts on STEM, science, technology, engineering, and math career exposure and training that we're working on. Thank you.